Hi there, it's Justin Lubino with Senior Advisors. And we've done this video in the past on 5 minutes of Medicare. We wanted to do an updated version for 2025. We're going to start off with the timer to see if we can get this done in 5 minutes. Obviously, we have a few disclaimers to start. There's a ton of rules with Medicare, so we're not going to get through every possible rule. So take this video with a grain of salt. Don't make any decisions based on it. It's just meant to provide some basic information and cover about 80% of the scenarios that we see with Medicare. Also, I'm going to speak very quickly to get through everything in 5 minutes. So the first question, are you ready for Medicare? Well, if you're turning 65 and you're not covered on a group health plan, the answer to that question is yes. You would have to get Medicare in place if you don't have that group or employer coverage and you're turning 65. Now, if you're working past the age of 65 or you're covered on an employer plan for an active employee after age 65, if the company has less than 20 employees, then the answer is also going to be yes. You have to sign up for Medicare A and B because that's going to become your primary coverage. However, if the company has 20 or more employees, we say maybe because it depends on how much you're paying, what your coverage is like, but you don't have to do anything with Medicare if you're covered on the large employer health plan. If you're retiring after age 65, you will need to get Medicare A and B in place. So once you decide it's time to enroll, we say it's easy as 1, 2, 3. 1 being enrolling in Medicare A and B, step 2 being enrolling in a Medicare supplement, and then step 3, the Part D prescription plan. So that first step, enrolling in Parts A and B, you can do that directly on the Social Security website, right at ssa.gov/Medicare/signup. It takes about 5 or 10 minutes, and you get your Medicare card in the mail about 3 to 4 weeks later. However, if you're enrolling after age 65, you're going to need the 2 forms below to complete and submit to Social Security to avoid any penalties or delays in your Medicare coverage. The first form is the enrollment in Part B, which you fill out and sign. The second form, which is more important, is the employment information form. And that gets filled out by the employer that's providing the health insurance. And that is how you avoid any penalties or delays because that has dates of your employment and your health insurance showing you were covered since you were age 65. Step 2, once you have Medicare A and B in place, it's going to cover about 80% of your medical expenses. We generally recommend a Medicare supplement to cover the other 20%. The nice thing about Medicare supplements, they're all federally regulated, so it's the exact same coverage regardless of which insurance company you get it from. It's guaranteed renewable for life. There's no private network, so you can go to any doctor or hospital in the country that accepts Medicare, which is pretty much every hospital in the country and about 99% of doctors. You don't need referrals to see a specialist, and it's great coverage. The most popular plan nationwide is called Plan G, Medicare Supplement. With the Plan G, the only out-of-pocket expense you have is the Part B deductible, which is $257. After that, Medicare pays 80%, the Plan G pays the other 20%. You have no co-pays, no co-insurance. It's great coverage. This chart shows us exactly how that Plan G works with Part A of Medicare. We're not going to go through the whole chart due to time, but the most important thing you'll see on the far right column here is you pay 0 for the hospitalization because Medicare pays its portion, the Plan G pays its portion, and there's nothing left for you to pay. Under Part B, as I mentioned, that's your doctors and outpatient. Medicare pays its portion, the plan pays its portion, and the only thing you pay is that Part B deductible, which is $257 in 2025. After you have the supplement in place, the third step is the Part D prescription drug plan. There's about 15 different Part D plans available in each state. We generally use a tool on Medicare's website. It's called the Medicare Plan Finder, and we just plug in the drugs and the zip code and dosage and pharmacies, and the tool does all the work and finds the most cost-effective drug plan for each individual. So that's steps 1, 2, and 3. Like we said, easy as 1, 2, 3. And just want to wrap up here. If you do need help with your Medicare planning, we're happy to assist. You can call the number you see on the slide or go to our website and you can book a call at a time that works for you. We are family owned and operated. We have over 1,000 5-star Google reviews and a 5-star Google rating, and we'd be happy to assist with your Medicare planning. I hope you have a great rest of your day. Take care. Under 5 minutes. There we go.